Hi, I'm Candy Stafford. I'm a registered veterinary technician in California, and my previous experience is with the vet school at Davis in small animal radiology for 23 years. This is all I did every single day, is to play with the animals and take good quality radiographs. So today we're working on positioning. And this is my friend Risa. She's helping me out today. So you could tell that this is really stressful for her, and we wished all animals were like this, but we're going to do basic positioning, and we're going to work on how to safely step away from the table. This is hands-free radiography. When you're doing 30 cases a day, you don't want to have all the exposure to x-rays, and so this is just part of our safety course and learning to step away from the table and use other restraining devices besides ourselves. Now we're going to start off with, and you could tell that Risa's really excited to be here. So consequently, we're going to start off with a lot of the lateral positioning, and then we'll move on to the VDs. And you could see that we're kind of getting her used to being on her back as I rub her belly, because that's what we do all day long, is talk to our patients. So starting with the lateral, we will talk about collimation, where to put the cross beam, where to put the sandbags, and I use these type of sandbags. They're 12 pounds and 7 pounds, and no matter whether I have a big dog or whether I have a Chihuahua, I use the sandbags the same way. So we'll start off with our lateral positioning. Now, when I measure, let's back up a little bit. When I measure, I like to measure standing, always measuring the widest part of the area. So if we're going to start with the thorax, the widest part of the area is right over the diaphragm. Widest part of the abdomen is exactly the same spot. So let's start off with our lateral projections. Good girl, Risa. I'm proud of you. Yes, yes. You're going to lie down now. Lie down now. Lie down. Good girl. And I want you to see that she, you know, like any dog, this is a scary proposition. So consequently, the one thing that I found 23 years ago is when we put the animals on the table, it's a scary thing. They're not allowed to be on the table. So we talk about other things like get in the car, go for a ride, stuff like that. And the thing is animals respond to us. When we struggle, they struggle. And it's just a bad situation, so pretty soon you're throwing your body over this animal. Well, this is what I found 23 years ago. The one on the neck is our big part of sandbagging and learning to stay away. If you only had one sandbag, this is the one I would get, the one that can go over the neck to hold the animal down. 12 pounds. There's no sand on the animal. The sand is around the animal. And the thing is that, stay, good girl, good girl. If you only had one, that's all you would have to use. So we start with the one on the neck. We're going to work on the thorax right now. Stay, Risa. Stay, you're a good girl. Yeah, I'm proud of you. The second one, no, stay, down, good girl. I want you to see a little bit of struggle. She's not being prompted to struggle. It's a normal reaction. This is not something that she would normally be doing, but the fact is that if I'm doing a thorax, one on the neck, one across the flank, this is the area we're going to be radiographing. We want to pull their legs out of the way. The small ones go on the legs. I have a last one like this. 4 sandbags is the way to go. And it's stay, always having contact with the animal, backing away, 6 feet away is little or no exposure. Let's work on where we put the crossbeam. I understand it's very hard to see where the light is, but we have a 4-way float table. Go for a ride, Risa. Good girl, I'm proud of you. We want the crossbeam, good girl, to be line up right behind the scapula. Opening our light field, leaving, just the width of the animal. We want from the sternum to the top of the back, and we want the light field to cover the whole thorax, from the shoulder to the 12th and 13th rib, putting that crossbeam right behind the scapula. And this is our look. Stay. Good dog, good dog. Bing, get your exposure as they're coming up in their breathing pattern. From the thorax, if I have to do with thorax and an abdomen, I'm going to move the animal down. Obviously, our sandbag can't be on the abdomen, so we've got to take it off there. I just swing it down, stay, to the legs, making sure we have the legs out of the way. and bringing the legs back, we just basically move the animal back, taking the crossbeam and putting it right behind the last rib. And again, it's all in the action of getting your hands off of them, keeping them calm, talking to them, back away, stay, 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 rotor up. You want to get an expiratory shot on the abdomen. When you're getting that nice abdomen shot, the expiratory phase is when the guts are the quietest. So inspiratory on a thorax, want to see a good lung expansion, expiratory on an abdomen. I have to do a pelvis. I'm going to move on down. I'm going to put the crossbeam right on the femur. And in the light field for the pelvis, we need to get from the stifle to the top of the back. We don't need all of the abdomen. We don't need all of the spine. But one of the things that we found years ago, stay Risa, one of the things we found is that we want to scissor the legs. You need to scissor the legs because when doctors are looking at the radiograph of a pelvis, they want to look at each individual femur. And so consequently, this is why we scissor the legs. We can have the down leg coming up, the back leg parallel to the table, and back so that they can individually follow up each femur. Lateral projections of the pelvis will never tell the doctors about hip dysplasia, but they will tell the doctors about that luxated hip. If there's a luxated hip, they follow each femur up and they can tell which one is luxated. It will also let people know about the lumbar spine, if the LS, the lumbosacral part of the spine, so that if they have any kind of changes in it, this is what the lateral projection will tell the doctors. One of the things that's also very helpful is when you have an animal that is very thin or an animal that might possibly be very fat, like we never have fat animals in veterinary medicine. Basically, I will use a wedge underneath the sternum to help roll the animal up so that it will keep the spine and the ribs all superimposed. So a wedge, a foam wedge, you can radiograph right through them, is really handy under the animal to keep them nice and lateral and parallel to the table. And these are our lateral projections. And you can see that Risa is a very good dog. She's an older Labrador. She's not sedated, but this is not a scary thing. Once you get your hands off of them, then you can work with them and get them to work with you so that you can step away and stay, get your shot. At the university, we were probably 8 feet away, never out of eye contact with the animal, but always away from the primary beam so that we're not getting the exposure. I have a lot of owners that ask me, what about the exposure to the animal? Is that hurting them? No. It's not hurting them because animals don't live as long as people do. And we as technicians, any of this exposure, we talk about where does the scatter radiation come from? X-rays come down in a cone-shaped area. They hit the animal, penetrate, go through the animal, produce that image on whatever way you're capturing those images. But the fact is the weaker stuff bounces off in a 360-degree spear. And for all of you techs that grab a leg and take a glove and hold that leg and put that glove on top of your hand, scatter comes from the patient. What is your hand doing there, and what is that glove doing on top of your hand? It's all coming at your hand, and that glove on top of your hand is doing nothing. And so consequently, this is one of the biggest things that techs do. They take that glove off, they hold that leg, they throw the glove on top of their hand, and it's not doing anything. Scatter comes from the patient. We wear gloves and aprons to protect us from that scatter. But the X-rays that are hitting our skin, that are hitting us, stay in our bodies forever. They don't leave. So consequently, learning to back away, 6 feet away, is little or no exposure. But the whole idea with the hands free is this, is keeping them calm, getting our energy off of them, and letting them see how this works. Now, we've worked on our basic lateral thorax, lateral abdomen, lateral pelvis. We're going to go through some extremities now. I'm going to start with the front extremity and then we'll move to the back extremity. I don't know if Risa is arthritic anywhere. Being a Labrador, she may or may not be. But we'll go ahead and we're going to start with some of these extremities. So we'll start with the lateral shoulder. Now measuring for shoulders is really interesting. The one way I suggest for making the lateral measurement is that when the animal is standing, you measure from outside shoulder to outside shoulder with your calipers. And then whatever that measurement is, you cut it in half. So now we're going to concentrate on this down leg. One of the things you need to do is be able to bring their heads up. If they have collars on, it's a good idea to take them off. You don't want any tags in there. I want the top leg out of the way. Stay, Reese. Good girl. I'm proud of you. Stay, Reese. Stay. Good girl. So we are going to take this shoulder and we are going to put that crossbeam, stay, sweetheart, right on the shoulder itself, bringing our light field down to just the area of interest. If you have too much elbow in the light field, it probably means you are not centered and you want to bring your light up a little bit. And like I said, it's very hard to see where the light is, but you want that crossbeam to be right on this shoulder itself. If I'm going to do a humerus, I'm going to bring my light field down a little bit, and this is the area that I'm going to get from joint to joint, from shoulder joint to elbow joint. Moving on down the leg, if we're going to do an elbow, I am going to use those same wedges and I am going to put the carpus up on the wedge. I'm going to put a sandbag on the paw, and what this does is this forces that elbow down on the table in a nice lateral projection. Moving on down the leg. Oh, and with the elbow, if you're going to do an OFA elbow, a flexed elbow, bring the leg up like that, and again on the wedge, put the sandbag there, and then we have a nice flexed elbow that way. And again, centering down, collimating down. I can't stress the importance of collimating. It not only cuts out the scatter, it gives you a nice image. The more scatter we have, it artificially, if you're using film, it artificially darkens the image. So consequently, the more you can collimate down that primary beam, the better it is as far as good quality radiographs. And I use the term radiographs. I don't use the term X-rays. X-rays are what comes out of the tube. The images that we produce are called radiographs. Now, if I'm going to do a front leg, I will use, animals don't like their feet touched. And so consequently, I try to keep all hands off the legs. If I'm going to do from a radius ulna, I'm going to go from the elbow to the toes. If I'm going to do just a carpus, if I'm going to do any joint itself, my light field has to be focused right on that joint. That crossbeam is right on that joint. Elbow, carpus, shoulder, stifle, any joint, any single joint that we do, that crossbeam should be right on that joint, meaning that we don't want to look at these joints at an angle. We need straight on shots for them. So we have the paw, the carpus, the metacarpal bones, we have the radius ulna and the elbow. So long bone type of situation, you want from joint to joint, we want from the tip of the toes to the elbow. So we have shoulder, humerus, elbow, radius ulna, carpus, all of it I use a wedge. If I don't want it to be up like that, I'll take the fat edge of the wedge just to push against the paw to hold it out there. And I like to, extend it out, not holding onto the paw like we typically want to do. The minute we get our hands off of them, this is how the animals react. So we've worked on our front legs. One of the things also, you may have a doctor that asks you to get, stay Reese, may ask you to get, stay baby girl, you're being good, may want you to get a neck. Necks are very hard to do to keep your hands out of the primary beam. One of the things that I find is really helpful, and of course we couldn't have her collar on there, so we have to kind of pretend her collar's not on there. I use wedges for keeping the animal lateral, nice and lateral, and I need to have them leave their heads down, and we don't want our hands near the primary beam. So I will often use either a sandbag to hold their ears down, or I will take a wooden kitchen spoon. And I will use a wooden kitchen spoon on their skull. And if the animal is being really good, I'll lay a sandbag across the arm of the spoon, holding their heads like that. Stay, Reese, stay. Good girl. Extraordinarily good dog. They're not always like this. You always wish you could have one, but she is being extremely good. She is very obedient. So I've never worked with this dog before, but I can tell you this is one I'd like to have with me all the time. So anyway, we want to get a lateral neck. The wedge is also good for doing a skull shot. It keeps them nice and lateral. I find that if I'm doing a brachycephalic dog or a cat, I don't always need the wedge. Their little round heads are kind of rounded anyway. But on these long muzzled dogs, this is really helpful to have to keep them nice and lateral so that you can get those lateral shots. Good girl, I'm proud of you. You're a good girl. Okay, moving down to the back leg. That's a good girl. Oh, we're having fun, aren't we? If I'm going to do a stifle, now one of the big stifle surgeries that we've been working with lately is a TPLO. TPLOs should always be done with the animal sedated or anesthetized doing these shots because you have to get them in a perfect situation. But we're going to talk about some things on doing these. If I'm going to do a femur, if I'm going to do a stifle, I will take the front leg and I will bring it up this way. The top leg. I will bring it up. Stay, baby girl, stay. I will bring the top leg up and keep it out of the way. Reese, no. I know. This is hard. This is hard. You stay. You stay. We need to see a little squirming here. I don't know how she'll be, but I want people to see this. Stay, stay. She is not sedated. Doing any orthopedic shots I do today, I couldn't guarantee because she is not sedated, but I think she'll let us do some things. We're going to work on the knee for a second right now, on the stifle. I need to bring that leg down. I take the top leg out of the way. That's a good girl. Do you have bad hips? Huh? You're being really good. I'm proud of you. So I'm going to take that top leg out of the way, and I want to force this knee down on the table. So I, again, use my wedge, raise the hock up, and take the sandbag and hold the tarsus down. Now her leg is not rotating down. I don't know if she's had knee surgery before or maybe possibly some hip things that are going on, but this paw doesn't want to rotate down and lay lateral on the table. But we're going to bring this knee and I'm going to center right on her knee. Now this is a normal stifle. This is a normal stifle shot. Nice, relaxed. Take that hock, bring the leg down, and this is the type of look that we want to get here. Just collimated down, hock up, stifle down on the table. TPLOs are done with wedges and sandbags. At Davis, we didn't hold for these, but basically we would take the top leg out of the way. I would take another wedge and I would force the knee down like this. Push on that knee, bringing the leg down to your 90 degrees. You can't have anything underneath the leg. But we can use, artificially, we can take those wedges and sandbags and hold the leg like this. So this is our 90 degrees. 90 degrees from the femur, 90 degrees down the tib fib. And to make those stay in place, I use sandbags. And then again, we just back up, and this is how we do it. Now, any of the rest of the hind leg, we have tib fib. And moving on down, just using the sandbags, I have tib fib, I have hock, we have our tarsus right here. And again, we don't want sandbags on anything like that, so I just use the wedges to hold the leg, and I put it like that. So we have from our stifle, tib fib, tarsus, and our metatarsal bones. We've already worked on the lateral hip. If we're going to do a femur, more than likely you're going to stay, Risa. You're going to bring the top leg out of the way. You don't want to hold it. You can just take a big sandbag like that and get them. I almost do like a VD pelvis and just a frog leg and bring their legs and bring them out of the way like that. So here's our lateral femur, stifle, tib fib, hock, and metatarsal bones. We're going to switch up now and we're going to talk about some VD positioning, and then we'll talk about some dorsal ventral positioning, but I'll start with my VD. So we're now going to work on some ventral dorsal positioning. Out in the private sector, most of the thoraxes, abdomens of course, pelvises are all done ventral dorsal. Now I don't have a helper here today. Probably the only shot that I do holding the animals is a VD hip. I do VD hips holding because it's easier than I don't run in and tape them. If the animal's anesthetized, always I'm out of the room. But if the animal's awake and they want me to get a VD shot, I'll put aprons on, gloves on, thyroid shield, and I'll hold the animal. It's much quicker. We'll see how she does today. I don't know how she'll be for me. Like I said, Risa is brand new to me, but she is being awesome, and I'm really proud of her. It really helps to have a nice patient. And we all know we don't get those every day. So we'll start with rolling them up. And again, measuring for a ventral dorsal, always the widest part of the area. We go from the xiphoid to the top of the back. This measurement will be the same measurement for a thorax and an abdomen, because this is the widest part of the thorax as the widest part of the abdomen too. So we're going to roll her up on her back. I'm going to start on your back. Good girl. Now, holding them up, I use a sandbag. A big one on each front leg. Good girl. Good girl. I'm proud of you. We're doing a thorax first. So basically it's just, then I take my small sandbags, and I don't really care about the positioning back here. It's mainly just keeping them up on the table. I then will straighten them up, and I'll tell you what, anytime you do a ventral dorsal view, the most important thing is to keep their head straight. If you keep their head straight, the animal will be straight. Stay, Risa, stay. So consequently, this is our ventral dorsal view of the thorax. Stay, baby. Go for a ride. Good girl. We want that cross beam again, right behind the scapula. Feel for the back of the scapula, doing the width of the animal, and then the whole length. Good girl. Sometimes I give them a pillow, which will help keep them nice and straight. So I'll just, put a wedge between their heads. But you will find that if you don't have a straight head, that head always pulls the body over one way or the other. Stay, stay. So you can bring the legs out if you want. I haven't really talked about stay. I haven't really talked about any of the extremities yet, but the shoulder will be done like this. Stay. And you can tell she doesn't mind laying on her back, but this is probably a little bit different than what she's used to when actually somebody is probably holding her. So it's stay, 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 good dog, good dog, good dog, and we get our shot. And I'm just kind of like taking her, bringing her legs up a little bit, bringing them up so that she can balance herself, because these sandbags actually really help them to balance on their back if you don't have any positioning aids. Stay. I do have a positioning aid that I use. If I can put the whole animal in here, then I will use my trough. You can see that she's bigger than the trough, so I don't like to put an animal in here to take radiographs when half of the body is in and half of the body is out. So if I have something that can fit in here, say from a beagle or a cocker spaniel, maybe even a smaller border collie or something like that. If I can put their bodies in here, then I will use a abdominal positioner or chest positioner. Stay, Risa, stay, stay. Moving on down, we just basically, if you're going to do a thorax, stay. Good girl. I know this is tough, isn't it? I'm not rubbing your belly. Yeah, stay, stay. So moving on down, I am going to bring my light field down to the last rib, the cross beam to the last rib, making sure that she is straight. And down here to this end, you can let them just frog leg their legs out like this, and looking at, and you have to tell if an animal is straight, you have to look at from this position. You can't stand to the side of the table and tell if they're straight. I have to eyeball her from here and then moving on down. So we have our thorax, we have our abdomen, Now the difficult position is going to be the pelvis. I don't know if she's going to let me do this or not. We're going to watch and see. If it can't be done because she's not sedated, I'm not going to crank on her and ask her to really do this. So I leave the sandbags on the front of the leg, making sure she's upright, and then I just replace my hands here with these 2 sandbags down here. Stay, Reese. Stay. Stay. Good girl. Stay. Good girl. And again, one of the positions for the hips is you hold at the hocks with your thumbs in. Now, we'll explain this in a second, but what I'm getting her to do is just to relax. I am having her pull, I'm pulling her hips towards me. I'm rotating them in. The one thing I'm not going to do is push them down towards the table. We'll talk about that in the mechanism of what I'm doing. But she is being extremely good. Like I said, we all know animals aren't always like this. We're going to struggle with them. They're kicking, they're fighting us. The more you can get your hands off of them, the better off they're going to be. Risa is not sedated. So for me to work with this dog and realize that this does not happen in the real world very often. So holding at the hocks, we take the knees and we roll them in. I am going to stand up straight and tall when I'm holding these. And I just want to roll those knees in, pull the legs towards me. I don't force them down towards the table. This is also how you would do a VD femur shot. If I'm going to do a stifle, it's the stifle on down, the elbow on down, she's going to be dorsal ventral. So right now, ventral dorsal, up, legs towards us, roll the knees in. Don't put the legs down towards the table. We're going to talk about the mechanism of that right now. Stay, Reese, stay. When you pull those legs towards you, you are taking the head of the femur and the acetabulum of the pelvis, and you are pulling this kind of motion here. When you take them and roll them in, you are distracting the heads of the femurs away from the acetabulum. When you take those legs and try to push them down towards the table, you are taking the head of the femur and the acetabulum of the pelvis, and you are grinding bone on bone as you push that leg down. So that's what animals fight you the most. We have found that you can rotate them in, you can stretch them towards you, and leave them parallel to the table, and you will get really nice pelvic radiographs. We do this for OFA, we do this for our standard pelvis radiographs. You don't have to push them down. Pull them towards you, rotate them in. You can see that that doesn't bother her at all. But the minute I try to start pushing this leg down, she's going to start fighting me. So this is the look that we do for a femur and for our VD pelvis. We will oftentimes, the doctors will ask us to get a frog leg. And basically a frog leg is I just push them up like this, you know, rub their belly a little bit, put a sandbag on them, and then it's like this. Stay, 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 stay. Good dog, good dog, good dog. Walk away from the table. And so this is getting yourself 2 feet away, 4 feet away, 6 feet away. We've got this dog nice and relaxed without us putting our hands on her so that we can get away from that scatter radiation. Now, front leg. We're going to talk a little bit about the front leg. We talked about the femur. I'm going to talk about the shoulder. Measurement for the shoulder, you can basically, whatever your MAS was, leave it the same. KVP, put your KVP up 10. Basically for our shoulder, I have a really nice sandbag here that I liked it with a grommet on it. And I like to tie a, the white gauze tie that you use for endotracheal tubes. I like to tie a knot through that, slip it around the foot, and hang it off the table, it's resting on the floor. And this gives you a really nice stretch job for your shoulder. So we have our shoulder. This is also an excellent scapula shot too. I don't know if my arm's in the way there, but we can get our scapula, we can get our shoulder, we have it extended out. Our humeral shots, I don't like to do the humerus because you see the humerus is at an angle. I actually bring a humerus back like this, and stay, baby. I'll put a sandbag here. I take a wedge and put it in here to move it out away from the thoracic area, and this is my humeral shot here. And believe me, this dog gets a star for being as good as she is because she just likes her belly rubbed. She's a good Labrador. Best breed around. So we have our humeral shot, we have our shoulder shot. Elbow on down, stifle on down. I told you we're going to switch to dorsal ventral. So now we're going to let her get up, and I am going to let her sit up, and she's going to think that she's released and it's okay to get off the table, but I have to talk her into staying for a little bit longer. Good girl. Good girl. Stay. Stay. Now we're going to talk about some more extremities, but I also want to talk about dorsal ventral views of the thorax and why we do a dorsal ventral versus a ventral dorsal. Animals stand four-legged. Their heart hangs a certain way. Our doctors at Davis like to see the heart in the proper cardiac position. When you take an animal and turn it over on its back, you drop the heart down to the back of the chest and you turn it on a different axis. So standardly, routinely, our second position for the thorax is a dorsal ventral view, so they can see that proper cardiac silhouette. So we basically just get them to stand up, and we have a chest, stay baby girl, stay, stay. And we have a chest positioner that's kind of a half one of my long body one. Down, 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 good girl. Bring your leg up, good girl, I'm proud of you. Good girl, down, down, good girl. Say, can you get your legs underneath you? Huh, is that a little crazy? She goes, I kind of like laying on my belly or on my back and having you rub me down, down, down. There you go, down. Good girl. Good girl. Now, you can see that her feet are slipping, and she's just a little concerned about this table with her feet slipping out from under them. That's when the wedges come in really handy. So basically, I'm going to put her in a chest positioner, and I'm going to use a sandbag, one sandbag, just to keep their head down, to keep the weight down, to free up my hands so that I can position the rest of the animal. They can't sit with the legs out behind them. That doesn't make for a straight shot, but I grab for my wedges at this time, and I use my wedges and my other sandbags to kind of bucket them up to keep them straight. So we take our wedges, and now I'm going to bring her legs underneath her. Stay, Reese. Stay. Stay. No, down, down, down. Good girl. I'm proud of you. And I'm going to use a wedge underneath each foot, bringing it up. And I could tell that she probably has had some kind of hip problem or maybe a stifle problem, that this may not be real comfortable for her, because this is something that you would think that this position would be really easy for them to do. But with bad hips or bad stifles, I keep all weight off of their back end because I want them to be comfortable. She is kind of like just barely putting her back end down. Down, stay, stay. I'm just going to let her get comfortable with this for a second. So basically, dorsal ventral position, just putting one sandbag on their heads, keeping their legs even, and getting their back ends up underneath them. Now, if it would be more comfortable with her to keep her legs together, I will do that. Whatever makes them comfortable. You get them comfortable, they're going to work with you. Stay, stay. Good girl. Stay, stay. You have a bad knee or bad hip, don't you? Yeah, well, that's okay. We won't force you. Dog hair. You can cut that out. So, stay, Reese, stay. Good girl. I'm proud of you. Good girl. Good girl. There you go. Good girl. No, down, down, down. When you know they have bad hips or bad knees, when they want to leave their legs out straight like that, and if that's more comfortable for them, I let them do that. Whatever's comfortable. So basically, we just get them up. Ventral dorsal, let them put their legs. If this is more comfortable with her, see, this may be a hip problem with this dog, even though she let me do her ventral dorsal hips. A lot of times these arthritic dogs, this is more comfortable for them than having their legs underneath them. So I want to just put a sandbag down on their head. That's a good girl. I'm proud of you. You're being really good. Put your head down. And then I will put the crossbeam right behind the scapula. Believe it or not, this is actually an excellent shoulder shot. When the doctors are looking at the tendons of the shoulder, the bicep tendons, then basically we will put a dog like this, and we call this the groove shot. and we shoot right down on the shoulders like this so that they can look at the grooves of the shoulders. Dorsal ventral positioning for our thorax so that we can look at the proper cardiac silhouette. And again, that cross beam will go right behind the scapula, and you just set them up and get them nice and straight. I will also use wedges sometimes. If I can't get them quite straight, I'll actually put a wedge underneath my chest positioner so that I can roll them up a little bit and get them straight. You can tell that she has a little bit of hip problem because this position right here with her legs is not normal, but it's more comfortable for her. And to me, it's like this: stay, 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 stay. Good dog, good dog, good dog. And we get them to stay like that. And again, straight heads are important, so I like to put the sandbags right in between the legs of these big dogs. If it's a smaller dog, the sandbag goes on the outside, and I just get them to stay. And you can tell that the way she's looking at me, it's like, hey lady, this isn't the most comfortable position. So now we're going to talk about some front legs, and then we're going to work on some back legs. I'm going to borrow this wedge out from underneath her foot. One of the things that I found, animals don't like their feet to be touched. The minute you start touching them, they start pulling them away from you. So one thing I found is when I am dealing with a front leg, from it being, you want to sit with your, you want me to fix your legs? I'll fix your legs. Come here. Down, Reese, down. I'm going to fix your legs to the side. Fix your legs to the side. There you go. Down, 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 down. Good girl. Let me put this underneath you. Good girl. Good girl. Down you go. Down you go. Good girl. Is that a little more comfortable? Is that more comfortable? You don't act like it. So basically, I use a wedge underneath their elbows to push their elbow out. Let me do this leg here because this one's a little more relaxed for her. You can tell this position is not as comfortable for her. I see it in her body language. She's holding herself very stiff. This is not something, maybe it's her right hip that she's having a problem with and I'm making her lay on it. She's being very good for me, but I just see it in her body language that this is not very comfortable for her. So basically, using a wedge, I put the wedge behind the elbow and I extend from here. I don't try to hold on to a toe, but everything is resting on an elbow so that we can, the wedge is underneath it, and like I said, you can radiograph right through it. If they've got their head in the way, basically if you need to stand there, you could take their head and pull it out of the way. Or we just get them and I call them and I'll say, Reese, and I'll get her to look over at me. And again, you have the light field directly on that elbow. Good girl. I'm proud of you. On that elbow, and I'm like this, stay, stay, look at me. And I get my shot from here, making them look over at me and bing, get the shot. But you can see that. You can get their head out of the way and you can radiograph that whole front leg. We talked about the shoulder. Shoulder and humerus are done VD. From elbow down to carpus, I do everything dorsal ventral. And again, no matter if you're doing an elbow or a carpus, if you're going to do a joint, you want to center right on that joint. So that cross beam will be right on her elbow, or that cross beam will be right on her carpus. A lot of doctors like to get the whole radius ulna with the paw in there, especially if they have curvature of the bone. And so consequently, it's this wedge behind the elbow so that you can keep your hands out of there. Stretch from here. Don't try to hold on to the toes and keep a hold of that leg. When you get them to stretch from here, it's very comfortable for them and they don't fight you. Now the back leg, we're going to go down. I haven't gone over a lot of spine, but the spine, if I'm doing laterals, is it from lumbar, TL, thoracic, are we boring you, and cervical. So consequently, the same thing is if I'm going to do laterals, I'm going to do those same one for the VDs on the spines. On skulls, because she is not sedated, I'll do my lateral, and then my next shot is a dorsal ventral view. And I'm going to flip her hips around right now because I think this is the uncomfortable position that we're fighting with. So I'm just going to get her, she's probably going to want to stand up, but I'm going to get her to flip her hips to see if maybe that will make her more comfortable. Is that better? Huh? Is that better? You're a good girl. So basically, if I'm going to do a dorsal ventral skull, and again, she's not sedated or anesthetized, so their head's going to be down there. I like to do dorsal ventral because then I can look at their eyes and see that they're nice and straight. Trying to do a VD skull when they have that bump on top of their head is very hard. They're always leaning one way or the other. But dorsal ventral, you can put them right down on their mandible and get that nice shot where you can look at their eyes and see that they're straight. Last thing we're going to talk about is the back extremities. And of course, I'm going to have to put this on her head to keep her down because this is probably, again, not her most comfortable position. But I'm just going to take the table and I'm going to swing it down this way. Good girl, Risa. We're almost done, baby. You're being a really good dog. So now we're going to talk about the back legs, like I said, I like to do dorsal ventral. I flipped Risa over because I thought she was a little more comfortable on her left hip from her right hip. So basically what I'm doing right now is I'm just flipping her back over to where I can get her in a comfortable mode and get her head down. I use again the sandbag on the neck to control that front end of the animal. While I'm working on the back end of the animal, when you don't have a partner helping you do these radiographs, and when you have an animal that isn't sedated, this is not always an easy thing to do. I use wedges to extend the legs, just like I do on the front legs. And so basically, I'm just going to swing her legs out behind her. Stay, good girl, good girl, good girl. Using the wedges, stay, to help make her a little more comfortable. So basically, it's a wedge under one knee. If I want to bring that leg up, down, 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 stay, good girl, good girl, good girl, good girl, stay. Using the wedges to help keep them from sliding around, I'll put a wedge under one leg. If I'm going to do, say if I'm doing her left stifle right now, I pretty much let her just get comfortable. Stay, I know this is hard. We already made you do it. Stay, stay. So basically, I've got her legs back out, but I just need to get her upright. And so using those wedges, stay. Bringing those legs out, whether they want to bring one out or whether they want to bring both of them out, the wedges really help keep those legs extended, one on each knee. So if I'm working on, say, the left knee right here, I'm going to use a wedge to keep it upright. Keep it extended out, so that I can have it extended out and setting my light field right on that joint itself. I don't use a lot of sandbags here except to maybe bucket them up and to keep them comfortable and to just use, say, on the foot. So we have our stifle, we have our tip fib, we have our tarsus, we have our metatarsal, and of course she would be I'd bring her up to the front of the table. But this is how I do it to keep them nice and comfortable. The keeping them comfortable, I think, is the biggest thing that we have to help us to get our positioning where we can get it quickly, get it done right, get them nice and comfortable. Like I said, putting that knee down on a wedge, centering right down on the joint. We have the stifle, we have the tarsus, those are two important joints, and you want those cross beams to be right on that joint. If you want that whole leg, like say if we were doing a TPLO PA view or a caudal cranial view, we need it to be upright and straight. I'll bring both of the legs back. If they want to keep their other leg up, then the one I'm not working on, then I'll let them do that. You can see by her panting that this may be a little bit uncomfortable for her, but by no means is she fighting me as far as extending this leg out so I can get my shot. So DV for any extremities from elbow on down. From the front, we call it AP or craniocaudal. And like I said, I've been in veterinary medicine for a long time, and I feel comfortable using the terms anterior, posterior. On the back leg, we're going from posterior to anterior, PA or caudal cranial. But I like these because we can get the joints right down on the table. No magnification. If we're doing hips, the legs are up. But when we do a dorsal ventral view, we've got that stifle right down on the table. We've got that tarsus right down on the table. There's none of this of trying to force them down in the ventral dorsal position. So DV on the legs, VD on the shoulder, the humerus, or the femur. Okay, you guys, that's all for today. I know we've gone over lots of things, but I think mainly in veterinary medicine, the thorax and the abdomen and the hips are probably our biggest shots that we do. And I would like to thank Risa because she was awesome. Thank you very much. Okay, we have Rebecca today, and Rebecca is like, see, we're giving us the attitude already, but I want to kind of let you know we talk a lot about dogs, but I want to give you an idea on my restraint on cats. The thing that I use, oh, Rebecca, stay. And you guys, Rebecca is the hospital cat here, and she thinks this is really embarrassing, so you have to understand, I'm not really worried about her biting or scratching me, but this is just how she complains. I use what's called a scruffer. Scruffer is actually a human towel clamp that I found about 16 or 18 years ago. I got involved with the company because I found they were an amazing tool. Basically, you take the scruff like you would with your hand. You clamp that onto the scruff, and this is what they do. They may growl, they may complain, but the fact is they lay there. And then I take them and oh, Rebecca, I'm sorry. I know this is embarrassing for you that you don't have to do this. So basically, I take them, sandbags, the small ones, and you can hear her, she's growling, typical response, I'm sorry, Rebecca, I know this is embarrassing, and basically the scruffer and step away from the table. That restraint, that little device is well known in California, well known in the United States. I have people that call it a mama clamp. But basically, the cat thinks I have my hand on her, so it keeps them down on the table. 1, 2, 3, step away, get your shot. Ventral dorsal, I'm going to just take the cat, and she finds this entirely beyond her capabilities of being a movie star. So okay, Rebecca. So basically, I take my hand with the scruffer, putting them upside down, and you can tell that this is not the happiest thing that she's done, but she responds very well to the scruffer. So basically, it's just stretch them out. I use sandbags to put on top of them. I use sandbags to put on their feet. Shh. I'm sorry, Rebecca. I know this isn't something you planned on today. You're the hospital kitty. Most hospital kitties, for all you technicians that recognize this, all your hospital kitties act like this. You have them because nobody else wanted them. I'm sorry, Rebecca. So you can see that you can step away and get your ventral dorsal shot. I'm not going to stress the cat out by going over all those positions again. Most of the time in veterinary medicine, we do whole body cats. I never recommended it when we had film. But with digital radiography, and that's my specialty now, is to being a being an application specialist for VetRay technology, VetRay by Sedecal. But the thing is that it's entirely doable with digital radiography. But whole body cats essentially is basically what most people do. But you can use the scruffer just long enough to get the animal in the position, and you can see that she's not happy, but she's respecting the scruffer, thinking my hand is scruffing her. So I'd like to thank you all today. We'll be ending with Rebecca, and she would probably like to leave right now. So the minute I take the scruffer off of her, it will be the feet of the disappearing cat. There you go. Oh, okay, bye, Rebecca.